Dr. Rodman, what is your opinion on cat eye surgery?
Okay, so this is Glamour, no fluff, where I'm telling you the truth about surgeries, whatever you want to know. So cat eye surgery, there's really two different components that people are calling cat eye surgery. The goal is a really extreme slanted eyebrow and eye. Now, one part of it, and this is the part that I will do, is a really dramatic brow lift. And so for these patients, it can be through a limited incision, a little incision in their hair. I will do a brow lift, and I'll do sort of an extended brow lift where I elevate into the cheek. And so they get a little bit of a mid-face cheek lift, as well as a really dramatic brow lift that's under a lot of tension. So it all pulls up. This can change the direction of the eye. So if the eye usually sits a little bit down or straight, pulling all of this up can change it so the eye slants up a little bit. The part that I do not recommend is cutting your eyelid. So there is a secondary part of the procedure where you can cut the eyelid and sew it up so a little higher to make a different angle. I do not recommend doing this for cosmetic reasons, and I think most oculoplastic surgeons do not recommend this either, because once you start cutting your eyelids, you cannot go back. And so scars left by this, if this is not cool in a couple years, you are stuck with this and other eyelid surgery that you might need in the future, say when you get older, if you have a skin cancer, you're in a tight position because now you have scars and really, really delicate tissue. So pulling up the brows creates a dramatic effect. It is not some of these effects that I've seen, say on TikTok, but I'm telling you, you don't want that. If you want a dramatic brow lift, I can do it. It will descend over time. So 10, 20 years from now, you'll probably just look back to sort of how you do now. That can be reversible, but don't cut your eyelids.